Welcome back and thank you for staying with us. And now we get into health matters, as I had mentioned earlier. And today I want us to look at a conversation that is really needed. Like, we really need to talk about this because it is a condition that affects many women and is quite challenging. So awareness on it is really important. And I am talking about endometriosis. That is our topic of conversation today. And with me is Dr. Wachira Murage, who is an obstetrician gynecologist, Savannah Healthcare Services. Welcome to the show.
Thank you.
All right.
Thank you, Vivian.
You're very much welcome. Let us begin by you just explaining to us what exactly endometriosis is.
Thank you very much, Dr. Murage. It's my name, as you have said, from the Savannah Hospital or Healthcare Services. And I'm a senior obstetrician and gynecologist, having served in that field for about 30 years. So I've met a lot of patients of various categories of endometriosis. Definition for endometriosis is endometrio means inside the uterus. It's an area within the uterus where the baby stays. And therefore, when you're talking of triosis, means that that particular area has moved to other sites. So you're talking about the cells of the endometrium, the inner lining of the uterus. They have gone to other areas and they can behave like cancer. Just the way cancer moves from one area, the primary site, and then goes to other sites, what we call metastasis. It moves around the same way endometriosis does. Those cells of the endometrium, the inner lining of the cells, they move to other areas. They can go to the lungs, they can go to the brain, they can go to the skin, they can go virtually anywhere. And we have had people presenting, as we are going to see, with various ways, depending on where the endo has moved to. So it's actually the presence of cells, and they're active cells. And this is going to really educate us on how does the endometriosis become symptomatic? How does it behave? And why does it behave? It is because those cells, wherever they have gone, they are active. So they are the influence of the ovarian hormones. Yeah.
So how exactly do doctors or gynecologists check for endo?
Endo is quite a very hideous kind of a condition. It can behave like many conditions. And when you are now thinking about endometriosis, the doctor has to have a high index of suspicion. Because as you are going to see the signs and symptoms, right? Because the way we make a diagnosis of endometriosis is from the history. Before we go to any other investigation, we want to understand how does endo present? Endo presents around the period's time. And you'll find that pain is the commonest presentation of endometriosis. So they have pain that starts from periods time, before periods time, and then peaks during periods time and disappears after the periods are gone. Remember what we have said in our opening remarks, that it is the ovarian hormones, right? The influence of the ovarian hormones or those endo cells, wherever they are. So you find that since they are open and the areas that are not open, remember for the normal placement of the cells inside the uterus, okay, they take time before they start presenting. But those other cells are exposed. You can imagine they're on the intestine. So they start reacting to the hormones. And that's why the pain will start before periods time. And then when the periods peak, it peaks with periods and then disappears after the periods are gone. So once we have that index of suspicion, then we can now go to other modalities of investigation. And why are we saying we must have index of suspicion? Because endo can present like pelvic inflammatory disease, for example. It can present like appendicitis. It can present like a urinary tract infection. It can present like kidney stones, pain just around periods time or any other part of the cycle the pain can come. So high index of suspicion is very important before we go to other modalities of investigating.
Yeah, and I just want to pick on that because for the longest time, me speaking also as a lady, we have normalized period pain. It's like normal. When you're on your periods, for most people, you just get those pains. So when should it be alarming for a woman to know that, okay, maybe these are not just the usual kind of, period pains that everyone gets to talk about?
they are very, 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 very strong, very vicious pains. They'll not give you peace, and they'll start before periods. The normal period pains, most of the time, start with the periods. That's when they go. And if you use the usual painkillers, the usual non-steroidal, what you call non-steroidal inflammatory drugs, the common ones that we use, okay, that pain will disappear. The pain for endometriosis will start a little earlier, and it will be very vicious, especially the periods come at the peaks. Okay, you try and use painkillers. Yes, for the first 1-2 months it's better, but after that it can't control the pain. Yes, that's how you kind of differentiate.
All right. What other symptoms can one look out for?
Other symptoms that you can look out for will depend on the area, okay, that the endometriosis is affecting. For example, you can have scar endometriosis, where we have had maybe an operation like cesarean section. You find that there's dark bleeding from that area. And then, of course, you find that there's going to be a swelling on that particular area. You can have the navel, kitovu, yeah, it will be like us. Yeah, you can have a swelling. Very shiny, dark kind of a swelling that comes during periods and pains, and can even bleed only during the periods, and then it disappears. Other people have gotten a cough with blood. That means they have endometriosis. Other people have even headaches. They just come before periods, end with periods, okay, and it is cyclical. It keeps coming. So depending on the area that the endometriosis is affecting, and then the cyclical nature, yeah, just before periods and pain starts, peaks with the periods, then disappears. Then between that time and the next time before periods, it is okay. Okay? So depending on that organ, that's where now you get the symptomatology. Of course, endometriosis can cause quite a number of things, including infertility. Yeah, some ladies are infertile, are not able to get children because of endometriosis. Others have gotten, for example, bloody urine because of endometriosis. So they just pass bloody urine around that time. Others have suffered intestinal obstruction because those endometriomas, because with the time, the accumulation of that blood in those particular sites can block the flow of stool, and therefore they are obstructed. They present with intestinal obstruction. Others have presented with nodes in the liver. In fact, endometriosis has been confused with cancer because of the way it behaves. Yeah. Yes.
Yeah. Can it be asymptomatic for some time, or it has symptoms all through?
Endometriosis can be asymptomatic for quite some time, until those cells now are big enough in a way that they are going to provoke. For example, GIT, gastrointestinal, some people have presented with things like nausea, feeling bloated because of endometriosis. In fact, it's a very, very common, and it builds with the time. It builds with the time until when it reaches a point, then it provokes some type of symptomatology, and that makes the lady go to the doctor. Yeah.
When does it start? Is there a specific age that is associated with endometriosis?
Endometriosis is a very, very, in terms of causation, endometriosis is a very, very, very dark, hideous kind of a disease, because it can start right from childbirth.
Childbirth?
Yes, when they are born, when those ladies are born, it can start then. Sometimes they can even start in utero, when the formation of organs was going on. Yeah, some cells, instead of all the cells going into the uterus, some remained in other areas, waiting for that girl to be born and the periods to start coming, and then the endometriosis can start building up.
Okay, that's new information to me, because I actually thought endo only begins, from a lady who has just started their period. So it starts from...
It can start.
From
and therefore it will show when the lady starts to have the period.
Okay, that's when it starts showing.
That's when it starts showing.
Okay.
So the cells can be dormant in a way.
Okay.
Because they don't have the hormones to provoke. And the hormones will start coming when they start having their periods.
Okay.
The other common cause is retrograde menstruation. So the periods, remember the way the anatomy, the female anatomy is. You have the uterus in the middle, then you have the tube sprouting kind of going next to the ovaries. The periods are supposed to come down into the cervix and into the outside private area of the lady. But all the blood is supposed to come that way. Some may go behind, retrograde. No, retrograde. So they go behind and they pour out into the organs, and then they are quiet. When the periods start and they are active with the hormones, that's when now they start getting the pains. It's really can be very, very tough pain for the young girl of 15, 16 years, 20 years, before you're able to discover. We say, oh, it's congestive dysmenorrhea, it's the normal period, but it becomes so irresistible that they have to see the doctor. And then a diagnosis of endometriosis is done.
Are there any other causes to endometriosis?
Now, endometriosis, the commonest cause is retrograde menstruation. That's what I've explained. Number two, of course, you can talk about hormonal, hormonal changes. Then you can talk about transformation of some cells that transform into some endometrial cells, right? And then other cells, someone is born with them, as I said. They are born with them, and then they're just dormant until 15 or thereabout years or 12 years, and they start having the periods, and then they are provoked. The other cause of endometriosis is scar endometriosis, like after a cesarean section, the scar. Or any other scar, maybe scar because of myomectomy, removal of fibroids. You might find that those cells normally can go. So surgery, surgery is a trauma. As it opens the uterus, those cells may move to those scars on the skin. And then with the time, those cells just accumulate. And it causes a lot of pain to the lady. Around the scar area, most of the time it's at the corner. They just say, oh, there's some pain there. Whenever I get periods, I get a pain. Then you start slowly. Then you find, oh, there's a nodule. There's a growth. All right? And if you ignore it, then that growth kind of pops out of the skin and may rupture and produce clotted dark blood. It's only once during periods. So surgical, procedures on the uterus are the causes of endometriosis.
But can, for example, the scarring or the surgical procedures, can that be prevented? Can that be blamed on the doctor who's performing the surgery, or because I feel like that can be prevented, no?
Not at all, not at all. In fact, you don't even realize, because all of us do the surgery the same way. We were taught in school. So, but somehow those cells, a bit of them may escape into the scar. So there's no prevention. It's not the way you do the surgery. Maybe, maybe one missed a step in the procedure or something. It is just, it happens. And one can explain how. We can't even explain how it happens. We all know that, we just come to realize that, this lady didn't have an issue, but after cesarean section, a couple of months or years, then they start having a painful nodule, a painful swelling on the scar that is associated with the periods.
Okay, that's quite a lot. Anyway, is there a way to prevent endometriosis from occurring?
Endometriosis, you can't prevent endometriosis. When you're talking about the risk factors, what are you talking about? You're saying, number one, starting periods early, is a risk factor for endometriosis. We are talking of obesity being a risk factor endometriosis. We are talking of having few children or having late pregnancies. All right? We are talking of extending menopause. right? Those are now the risk factors. And if you look at what we talked about as the possible causes, so if you look at now what we would call the risk factors, plus what you would think of as the possible causes of endometriosis, there's really nothing you can do to prevent endometriosis. You're talking about also family. If you have how common occurrence of endometriosis along your family line,
so it could be hereditary.
Could be hereditary, but you can't do anything about preventing endometriosis. It just comes, and you can't do anything. Yeah.
How does endometriosis cause infertility in women? Because you mentioned for some women who have endometriosis, most of them could not have the ability to conceive.
Yes.
Where is the interference between the two?
Is a chronic infection. Chronic means sort of like lifetime.
Yeah.
When it comes, it has to have that kind of a natural existence. And it's inflammatory. Inflammatory means it's causing inflammation.
Yeah.
Anything that causes inflammation may cause things called adhesions. Adhesions are like healing tissue that can hold something, adhere. They can cause holding. So what does it do? It may hold the tubes and cause obstruction. It may go there and damage the ovaries. Remember, you're talking of blood on the ovary, because endometriosis can go onto the ovaries and cause bleeding on the ovaries, and therefore cause inflammation, destroy the ovaries. So ovulation will not come. The other way that it can do is it damages the egg pickup. If you look at the anatomy, the fallopian tubes have finger-like projections like that kind of pick the eggs.
Yeah.
Okay? Adhesions over there, can also prevent ovum pickup. And of course, naturally, this pain, even sex is a problem, because painful sex is another major cause a major symptom of endometriosis. Depression also is a major symptom because of this crazy pain. And of course, no low libido, it's also associated. So if you look at all those factors, they are anti-fertility, and therefore they cause infertility.
Are there different stages to endometriosis? Is there stage 1, stage 2, and how can one maybe limit the endometriosis from moving or from progressing?
Yeah, good question. Endometriosis goes up to stage 4. Okay, so you can have the endometriosis just next to the ovaries and the uterus, and some on the outside wall of the uterus. That will be stage 1. Then stage 2, you'll go next to the adnexa. Adnexa is the area surrounding the uterus and up to around the ovaries. Then stage 3, you'll go to the covering, the peritoneum, covering the area, the kind of covering of the abdomen. And then stage 4, we will go to distant organs, brain, heart, kidneys, liver. It can go intestines. It can go to all those organs. That's one way of grading endometriosis. A second way is superficial, because endometriosis can just be on the surface of organs. The organs that you have mentioned, it can just be on the surface. The other one is DIE, deep infiltrating endometriosis. It can go deeper, like the way cancer goes deeper into the organs. And it can do that in the bladder. It can do that in the intestines. So that indeed, one of the operations you can do is to cut a part of that organ. And this brings to a point of treatment, just in case we don't get there. The treatment for endometriosis, surgical treatment, is a multidisciplinary, especially in the deep infiltrating endometriosis. And of course, the widespread endometriosis, because it has touched organs which are outside the gynecological region. For example, if there's deep infiltrating endometriosis in the bladder, you have to have a urologist, because you're going to cut a bit of the bladder where it's really invested by the endometriosis. You can do that as well on the intestines, because portion of those intestines are also are also involved in the endometriosis. So that's the way you can you can grade the endometriosis.
Yeah. So
from the distant organs and to the extent that it has affected the individual organs. Yeah.
So stage 4 is where it has blown off from just the uterus. It's gone off to different
far to other organs.
Okay. We take a break right now, but when we come back, I would want for you to tell me how to prevent it from progressing, you know, from moving from stage 1 to stage 2. Is it possible to do that? Yes. We will get back to just to get to understand more about endometriosis. Don't you go too far. We take a short commercial break. And we are back. In case you're just joining us, our topic of conversation is endometriosis, and I have Dr. Wachira Murage with me. Before we took that break, the doctor has just explained the different stages that endometriosis goes through, the stage 1 to stage 4. And I was just asking you, Doc, is there a way to progressing from a stage to the other?
Yes, indeed, early intervention, early diagnosis, intervention in terms of treatment, really helps to prevent the progression of the stage 1. Then you use the medications available, because in terms of treatment is multidisciplinary. There is medical, there is surgical also. It's also laser, which is really coming up. So early detection, diagnosis, and intervention is a cornerstone to prevent progression. But what happens locally? The diagnosis is made very late. Yeah,
and that also leads to a question I had on the same. Are we well equipped to tackle endometriosis? Do we even have enough medical personnel who are, you know, trained on that? Because most times from the stories we get to hear, you know, many a times it's late diagnosis. So it gets to be discovered when it's in the last stage, or when it has really progressed. So how do we go about that? What needs to be done? Do we really have the proper equipment for it?
Indeed, we have shortages in terms of personnel, we have shortages in terms of equipment, and that's now limits the responsiveness, you know, to the diagnosis and management of endometriosis. You realize that the patients will be taken through a roller coaster of maybe treatment for PID, treatment of, you know, pelvic, you know, conditions, adhesions, and all those things before it is discovered. There's endometriosis. So what we need as health professionals is high index of suspicion. The number 2 thing that we need is to create a good referral system. All right? This lady has been having pelvic infection. I mean pelvic pain, chronic pelvic pain. We have treated for infection. We have treated for urinary tract infection. But years on end, every month they're having of pain. This refer to a level where you have a gynecologist who can now think through endometriosis and try and institute the treatments, be it trial treatment for endometriosis to discover whether there's improvement of clinical symptoms, you know, doing a person who can do a good ultrasound. These days, gynecologists are doing really good transvaginal, leave alone transabdominal. Transvaginal ultrasound through the vagina is a very key and can be able to detect quite a lot of endometriosis. And therefore, they, you know, decide, do we start with medical treatment, then for laparoscopy? And therefore, again, now we need a center that has trained personnel and good laparoscopic, you know, machinery that can now undertake a successful, you know, laparoscopic, you know, evaluation in terms of a diagnostic laparoscopy to be able to tell us where the endometriosis is and be able to help in the grading of endometriosis up to now excision of endometriosis. If it is a grade 3 and 4, the one we said is deep infiltrating, do we have a center that is equipped with laparoscopic gynecologists, laparoscopic surgeons who again now can undergo that extensive surgery? Before we even get to that, a center that can do a good MRI magnetic resonance imaging test that can now help to diagnose and even tell us the stage of endometriosis. Is it deep infiltrating? Which area is it affecting? We might also need, and this is we are talking about the health resources that can help make a conclusive diagnosis of endometriosis.
Yeah.
Do we have also surgeons who can do colonoscopy? They can check the colon and be able to say, can they do an OGD to the endoscopes right into and discover is there gastrointestinal system, and therefore now to really decide, and then you have a combined effort. Those particular kind of referral system in that order that we have described, it's quite not there locally. Yes,
unfortunately.
Yeah.
All right. Maybe what are the treatment options available? I know you've touched on laparoscopy, that's surgery.
Yeah.
Are there any other treatment options?
Once we make a diagnosis of endometriosis, as we have repeated severally during the program, is that it's a multidisciplinary. So once you have made a diagnosis, you need to speak to the client about endometriosis and the longevity. We say it's a chronic disorder. And then you take them through some of the complications of endometriosis. And then you bring in a clinical psychologist, because if there's endometriosis, there's the aspect of the pain. There's the aspect of even the family, the way it affects the family, the relationship, even with the spouse. You need to bring them, it might cause infertility. Yeah, so all those things, they need to be discussed so that the patient is aware of the global picture of the condition. Then of course, once that one is done, then depending on the stage, then you can now start on medications, and there are several medications. Some hormonal modulation, we call them GnRH analogs, to swallow or injections. Yeah, and then of course they're bringing up now the slow-acting ones that you can put on the skin, and then it just goes into the system and goes to reduce. The thing here is, and how those medications work is to try and block the effect of the ovarian hormones on those endometrial cells. All right, and that's why these patients, you always get menopause-like symptoms. The sweating, vaginal dryness. They normally get that, and the hot flashes they also get. So those are medications. Other times we may want to postpone the periods, and therefore you can use the combined oral contraceptives, right? Because once you do that, they don't get periods, they do not get the pain, to alleviate the pain. So there's the medical now treatment of endometriosis. And then of course now you can go to radiological. It's also coming up, where you would want to destroy some of those using laser to destroy some of those endometrial cells. And then of course there's the surgery, and most of the time it's laparoscopic. And this one is really good when there's a swelling. Remember endometriosis, that recurrent swelling, that recurrent forming of the endometrial blood that is not going away, is inflammatory, it tends to coagulate at a point and make a mass. So we call them endometriomas, and it can be very, very painful. Surgery is very, very successful in those kind of scenarios where you have a mass and you need to remove that mass, okay? And therefore now you can destroy the other remaining cells using the medication. Surgery is also nice for scar endometriosis, where you have a mass, again. And surgery, thirdly, is very important when you're talking about deep infiltrating endometriosis, where you can now bring in the other specialties. And the other specialties depending on the organ involved. If it is the chest, if it is the gut, if it is the urology area, where, the ureters and the bladder, then you can bring the other surgeons. Then after that, then now you can continue now using the medications to try and maintain. But the endometriosis is a very, very tricky condition. And just to mention, it is individualized. There are people who do so well on medication. They even melt those masses. There are others that you first use the medication, you melt, you clear, then you have other now discrete nodules that you must now go in for surgery. So it is individualized, you know, and the response of treatment is from person to person. How do they take in the counseling? How do they react to the medication? How is surgery? How successful? You know, and the staging, of course. So there are all those factors that you look into when you're trying to treat endometriosis.
All right. Yeah. Speaking from the capacity of someone who has no medical background whatsoever, that is myself, you mentioned that you can stop the periods. Isn't that like the easiest way to go about it? Because you just stop the periods.
Yes, just like a lay person you have spoken.
Yeah.
But remember, you can't stop the periods for long.
Forever, yeah.
Remember, this is most of the time our young people, they want kids. Remember how important periods are to a woman, so, you know, and then of course these are medications. Even if we're talking about the family planning pills, they also have their own, well, they have another flip side. You know, you have to keep taking something. You can imagine taking something every day, so it should not be comfortable. Remember, they can also cause bloating, you know, blood pressure, weight gain, some chest pain, nausea. You know, some of them will cause low libido. So they are all those. So you can only postpone the periods for some time. Okay? The surgery, again, that we look at is to remove the uterus plus the ovaries, you know, as a last resort. Yeah, in fact, if you want to do away with the endometriosis, for good is to remove the ovaries. But remember, endometriosis is a condition of the, you know, the people who are in the reproductive age group. Okay, so you can imagine a girl of 25 years, you can't even think about that. Yeah, you have to give them time. Yeah? And remember, again, when you do that, you remove the ovaries, then you directly set them to menopause. Then you be ready to handle the other problems of menopause, including osteoporosis, again, which is also quite a debilitating condition if it strikes in a patient. So there's that kind of surgery, and those surgeries, you can do them as a last resort. Treatment for endometriosis is individualized. There are others that you can see, this life is unbearable, there's nothing you can do, they can't go to work, they can't eat, they are thoroughly depressed, and therefore then you can consider now some of those radical operations.
Okay. All right, as we almost come to a conclusion of this, maybe what role does diet play in managing endometriosis? And maybe also for someone who already has this condition, what lifestyle changes should they also try and make in order to also manage the condition?
Yes, lifestyle changes are very key. Things like smoking, we'd want people to do away with smoking. We want them to exercise, because when they exercise, the body is able to adapt better. The response to pain, you know, becomes better. Of course, remember we talked about obesity again. Their body, a healthy body resists these conditions, and therefore even in endometriosis, they resist better. So in terms of even diet, let them take a healthy diet, because it helps. A healthy body, athletic body, you always resist these conditions better. And there's also an immunity side of it. And therefore, when there's a healthy diet, then it helps. Remember, there are also some elements in our food, you know, maybe be it pepper, be it many other sort of food elements that can provoke, you know, pain, and therefore we want them to, you know, to do away with those. But in terms of, you know, exercise, you know, in terms of balanced diet, it is good because it helps the body to resist even the endometriosis itself.
All right. I'll allow you to give us your last remarks on this topic, and maybe just get to encourage someone who lives with this condition.
Yes. Thank you very much. I would want to say, yes, endometriosis, we have said, is a chronic disorder, a disorder that stays for lifelong, but we should not be depressed. We should not feel like we are outcasts. There is help for endometriosis, just like we have discussed in today's topic. You can get your baby, you can lead your healthy life, and you can do whatever you need to do in your life. Endometriosis is not a fundal condition. I know some time back we lost a patient, but just like any other condition, some things can happen at the worst, especially if you neglect endometriosis, then you know things like those ones can happen. But there is hope in treatment endometriosis. Should you be treated for chronic pelvic pain over a long time, do not hesitate to ask your doctor, could it be endometriosis? Because there is help, you just need to go for it. Thank you very much.
Thank you so much, Doctor. We always appreciate your presence on the show because we so much. So thank you so much. All right, and this conversation brings us to the end of Good Morning Kenya today. Thank you so much to each and every in from the moment we started the show to this bit of the program. My name is Vivian Dagwa. We meet again tomorrow, same time and place, God willing. Do enjoy the rest of your viewing. Goodbye.